Now I want to work on psoas.
Okay.
How are we going to work on psoas when it's facing on the ground?
Easy.
That's what people say. We were all taught go in through the belly. Take our fingers, our sharp, pointy fingers, and stab them into the belly, right? That doesn't feel good on my fingers. A little painful for the client, right? It's a very gentle psoas stretch. Robert is very flexible, so I'm going to show you a couple of different ways how people respond to it, okay? So once we've softened up the gluteals, we're going to come in, and on the other side, cross body, I'm going to come over and grab this ankle and hook in, right? And just walk back, right? I've got a loose arm. If I want more, I just lean, right? Really easy. Robert, how's that feel for you? Robert, where are you feeling that at? All that jazz, right? Who has tight jazz right there?
The world.
Everybody. You sit down, you got it, right? Robert can handle a little bit more, so I can walk this way. Ooh, how's that feel?
Awesome.
Right, super awesome.
Awesome.
And I'm glad the camera's over there because it's not getting my belly.
No,
I know you gotta
that's
get
what we'll
the
do.
angle, right?
Just drape a blanket over, protect your clients. Yeah. So I've got a hold of his foot and I'm just leaning back, hanging out, letting him breathe. Do whatever I want, right? Now I know Robert wants a deeper stretch because I know him. Plus we've also worked it up. So when I do this, I'm gonna come bring his leg up. I'm gonna take my foot, put it right here in this low back and stabilize that low back as I then pull. So I'm doing this kind of a motion. This is coming this way. This is going down. I'm stabilizing. Some people can find this painful. So just back off. I am using the soft foot, the arch of my foot to stabilize. I could go in there with the heel. Sometimes, depending on the client, they love it. Sometimes, I don't want to do that. It's a little intense, man.
Yeah.
Right? Really, we're just going to stabilize, listen to our receiver, and then come back out. You guys think you can do that?
Yeah.
Look, we just did psoas while they were face down without jamming my fingers into that belly.
And you also work the glutes still.
I worked the glutes,
No.
all of it, all that chain.
So like this whole area, and like
IT.
it's always funny for me because I teach this stuff, right? And then somebody works on me and I'm like,
Oh.
my God, this is so good.
Yep.
Man, this is so good.
Yep.
This like whole area, like I wouldn't, like if she would have asked me, do you have a problem here? I'm like, nah. But then this whole area just feels like so open compared to the other side.
Right.
Yeah.
Yeah.
All right, I'm going in.
Let's try it. Let's see how that feels. Whomever, it's fine.
What are we doing?
Well, that's
You want me to,
I was totally on point, so you'll just get to experience.
Also, I just thought about this.
Mhm.
So I did this naturally because my head was already turned this way.
Mhm.
When she grabs this leg now, my head's turned. And this is okay for me because I've got enough spine mobility, but it'll be easier for the client. They're wiped out at this point. You've already done the supine sequence, right?
Mhm.
I'll tap them on the shoulder and say, can you turn your head to this side? And they'll turn their head so it doesn't twist their spine.
Mhm. There's not as much tension on that neck.
Okay, so she's looking that way, I want to go this way.
Yeah. Or you can just tell her move her. So.
But she looks so comfortable.
No, I agree. Meet her where she's at.
oh, thanks.
Meet her where she's at. How do we feel? We're gonna grab, walk across. Got that hook in? Oh, perfect. And just bring it across. Oh, so that looks amazing. Yeah, come on, baby, walk this across. Don't be afraid. She can do it. There you go. David, that looks wonderful. That looks beautiful.
Can we feel the stretch?
How does that feel for you? Right. Now, givers, do you think that you could put a soft foot in that low back? On the other side of the spine, we're not going to press into the spine.
Right above the iliac crest.
Right above the iliac crest. It's almost like there's a little cradle for your foot. You can feel it right there in that crease.
There you go.
How does that feel?
Good.
Sometimes it's easy to really push in. Seems like he likes it. Some clients might want it a little bit less.
Good.
Yep. So then you
That's
found
too
her
much.
limit.
Yeah, very quick.
Mm-hmm.
Like,
Yep.
almost
That's just where she's at. A lot. So the thing is, you have to realize your legs are very, very strong.
Am I doing this right?
Looks beautiful. Your legs are very strong. They use, we use them to walk, we use them to kick things. We use them to do other things I can't think of right now. But they are very strong. It is very easy to give too much pressure on that stabilizing foot.
I keep finding it right there.
That's okay. Just soften your foot.
Practice on the other side.
Go to the edge and you come back and you go and you come back and
Mhm.
it's kind of like weight, like
Introducing that touch.
past it. It's good.
Mhm.
Feel that pull.
It's definitely a difference.
Yeah.
Not a major difference. But let me see.
I guess so.
But you also haven't received it. You'll feel it. It's okay. Wind your stance a little bit. There you go.
And we have a little more time after.
Mhm.
Okay. So yeah, I think.
Yeah. How does that feel, givers? A little awkward?
It was at first.
Yeah.
Can you move
But I'm
your foot
just
just a little bit higher,
Really
just above
aware
the
how
There you
tight.
go.
There.
Oh, yeah.
You see that cradle that it
Yeah.
slides in?
So when you're on my iliac crest, it's like it. Okay.
It's
When you're on
stabilizing.
my iliac crest, it feels like the focus is my hip flexors.
Mhm.
Right, which
When
is
you
mirrors.
when you're above the iliac crest, it feels like it allows my sacrum to move
Mhm.
Yeah.
and access the psoas.
Okay.
It feels like it isolates it. more.
Okay. Thank you for
It's
that.
not wrong.
How did that feel for you?
Thanks.
Good.
How's that?
Do you want to do me?
Oh yeah.
So I can see.
Yes, our beautiful givers are now going to be our beautiful receivers. Right, good job. Big deep breath in. Feel that, right? There you go. Who needs psoas work? Everybody. Everybody needs psoas work. Right? Here's my question though. How many people are very sensitive and protective of their belly? Right?
When you had the emotional episode, was too much pressure back here?
How does that feel for you?
I was
feel
making
good?
sure because I'm going
Does your
back
leg
to
feel a little bit
similar
heavy?
area and I didn't want to
Good job, you're leaning. You got it.
How's that? It's good. You let it pop. Finally, it's just like it pops.
It pops. It's good.
Yeah, this is the side that bothers
If you want to look to the side,
me. And then it's fun.
so it's a lot just like
And then
blocked
just
in
let me
there.
know.
So I've been working on it for the
Just
past.
tap out if you need me to go less, and then give me a thumbs up.
And you'll also feel that tension too.
How's that
Good
feel?
job. Good job leaning back. There you go. Don't want to lift with our arms. And then for you and your clients, do you see how we're not getting into their space, right? A lot of people are very protective of their belly, but they need this work. Right? It's a very nice passive way to get that for them without overwhelming them. Plus, they've got a lot of that space. They can escape if needed.
Yeah.
It'll feel like you're in the soft of the small of their back.
That's what I was.
What I call it is dancer's foot. Because my foot essentially, I would be reaching across, I'm not doing it right now. This ball pad on my foot would be right along the spine, just above the iliac crest.
I have a tendency to stable with the arch of my foot and turn in. That's what works for me. That's what works for me. You on that bone? You're gonna be right here. Right here. Okay. Do you feel that bone right there? Good job. How does that feel for you, Danielle? David! Kind of right on your shirt.
Can you take a little more?
Good job. How does that feel for you?
It's interesting.
I don't want to go to Abby, so I'm not.
Huh?
Oh,
You don't want to what?
no, I'm just.
Oh, okay. Have her stretch the other way. Yeah. Yeah, good job, Andrea. Yeah, that's the great thing. Good job, Andrea. I loved watching you.
What side did we do? Thank you.
We're going to do this side.
It also depends on where you feel
the-
tension and tightness.
And again, here I go asking about